CBD oil can be useful for stress and anxiety. While delta-9 tetrahydrocannabinol, THC, can have a bad rap for being intoxicating and anxiety-inducing, cannabidiol, CBD, can actually be used to relieve anxiety. Research supports this benefit, with several studies reinforcing the positive effects CBD can have on various anxiety conditions. CBD isn't yet legally cleared as an anxiolytic, or anxiety relief medication. Therefore, it's up to you, and, ideally, a doctor who specializes in cannabis administration, to determine whether CBD is a safe treatment for your anxiety. Here's what the science says regarding CBD's anxiolytic properties, along with experts' dosage guidelines and advice on how to take CBD safely. CBD for anxiety. The Food and Drug Administration, FDA, has yet to approve any CBD-based medications for anxiety. However, many studies indicate the substance can be an effective anxiolytic. CBD for generalized anxiety. In 2011, a small trial tested CBD on participants with generalized social anxiety disorder, SAD, and healthy control patients undergoing a simulated public speaking test, SPST, which is a common anxiety testing method. Compared to a placebo, CBD significantly reduced anxiety and discomfort in the participants with SAD. In fact, their reduced anxiety levels were comparable to those of the control participants. 8 years later, a 2019 test compared the efficacy of 3 CBD doses, 150 mg, 300 mg and 600 mg, and a placebo in men taking an SPST. Compared to a placebo, 300 mg of CBD significantly reduced participants' anxiety during the speech, but the 150 mg and 600 mg doses did not. These results highlight how dosage can be highly variable and that more CBD isn't necessarily more effective. Meanwhile, another 2019 study tested CBD in much lower doses than most other clinical studies. Some participants consumed 25 mg a day while others consumed 50 mg or 75 mg a day. Researchers thought higher doses might be too expensive for participants to maintain in their normal lives and that low doses would still prove effective. Indeed, anxiety decreased within the first month for most participants and remained low. Sleep quality also improved, although it fluctuated more than anxiety. Only 3 patients reported side effects. CBD for anxiety and depression. In 2020, researchers tested the effects of CBD oil at varying doses across 397 patients with a variety of ailments. Participants with non-cancer pain or mental health-related symptoms experienced significant improvement in anxiety and depression, as well as in their abilities to complete their usual activities. The use of CBD oil suggested significant pain relief in these groups as well. CBD for PTSD and phobia therapy. A small 2019 study of 11 patients found that, when consumed orally and administered alongside routine psychiatric care, CBD decreased patients' post-traumatic stress disorder, PTSD, symptom severity. Other studies suggest CBD can reduce PTSD symptoms when consumed with THC. When taken together, the two compounds create what's known as the entourage effect, where THC enhances the effects of CBD as CBD tempers the effects of THC, resulting in a more well-rounded experience. Some studies also suggest CBD can enhance the effects of exposure therapy, which assists patients in dissociating certain cues with a fear response, and cognitive behavioral therapy. How to use CBD for anxiety. Without clear FDA guidance, optimal CBD use for anxiety varies from person to person. You may find one method works better for you over another. You can consume CBD in the following forms. Oils and tinctures, which come in dropper bottles and are consumed by mouth. Gummies, which are chewable, sweet and often fruit-flavored. Sprays, which come in bottles with a nozzle to be sprayed in the mouth. Capsules, soft gels or tablets, which are taken individually by mouth like a pill. Vapes, which heats CBD oil without igniting it, resulting in an inhalable vapor. Flowers, which are dried hemp plants that are typically ignited and smoked. Creams and gels, which introduce CBD topically, through the skin, as a more localized treatment. You may have to try different forms to determine what works best in addressing your anxiety. For instance, when it comes to the absorption of CBD in your bloodstream, vaping and smoking are more effective than edibles like gummies. CBD dosage for anxiety. You also have to find the right CBD dosage for your anxiety. Experts suggest starting small and working your way up depending on how your body reacts. Many clinical trials jump right to testing high doses. Successful doses evaluated for anxiety relief specifically include 600 milligrams in patients with SAD in a speech simulation, 300 milligrams in male patients in a speech simulation. However, other trials suggest much lower doses are also quite effective in treating anxiety. 25 to 75 milligrams for generalized anxiety and/or sleep problems. 33 to 49 milligrams a day for PTSD, in addition to routine psychiatric treatment. Another study involving hundreds of patients noted success with doses from 40 milligrams to 300 milligrams a day, further supporting the idea that CBD dosage varies significantly, depending on a person's symptoms and physiology. Potential risks and side effects. The World Health Organization deems CBD a safe and generally well-tolerated substance. Studies report very few adverse effects, if any. However, taking CBD while on other medications may pose a risk, as these substances may interact and cause unwanted effects, such as weight gain, drowsiness, upset stomach and change in appetite. Cheryl Bogielskis, MD, a cannabis specialist at Healy, a telehealth platform for alternative medicine, also warns people with pre-existing liver injuries and people taking medications that can cause liver injury should practice caution when using CBD. Thanks for watching. And don't forget to subscribe.